Good evening. I'm a school teacher of over 20 years and currently a deputy principal of a primary school in Victoria. Personally, I don't feel enough's been done to diagnose, flag or even recognise the magnitude of trauma caused to children who are in isolation. Some may have witnessed family violence, financial hardship and even deaths of family members. My question is to the panel. How is the government prepared to deal with the wave of depression, anxiety and mental anguish caused by these lockdowns to an already vulnerable generation of students?
All right, at this point I want to introduce Dr. Killian Ashe. He's a psychiatrist at the Royal Melbourne Hospital, obviously working at the acute end of all of this. What's your view on that question there about the impact this is having on a very vulnerable generation of students right now?
Well, Hamish, thanks for having me. It's a pleasure to represent mental health frontline workers, but of course also the people that we're servicing. And as the gentleman pointed out, this is an unprecedented stress on the entire community. And we in psychiatry don't necessarily have any magic answers to that, but what we want to do is support our medical colleagues and the broader community at large, including teachers, to understand what it is that's occurring and then I suppose, shape and guide the response to it.
Yeah, can you give us a picture of how big the impact is at the moment? I mean, are you seeing these statistics that we're reading about in the newspaper, 33% rise in the number of young Victorians presenting to emergency departments for self-harm in the past 6 weeks? I mean, the statistics are shocking and particularly so for Victoria. Can you describe what that's like in person?
Absolutely. Well, look, I think the Victorian Minister for Mental Health put it very frankly and honestly yesterday when he said that prior to this crisis, we had a mental health system in Victoria, but Australia-wide, which was not fit for purpose. Now, notwithstanding that, there's phenomenal work done by the mental health clinicians and the support workers of this country. And I think we need to pay tribute to them tonight. They're absolutely exhausted, they're burnt out, but they're out there to provide a service for you. We have seen year on year 20-25% increase in demand across every breadth and aspect of our service. But at this time, we've now seen a 25% increase at the Royal Melbourne, for example, just since March across this pandemic period. So it's important to acknowledge that we're seeing at every age range high levels of stress response, unprecedented levels of anxiety. And these are, I want people to realise, these are very understandable reactions. You're not weak, you're not less than for having these. And I also want to reassure people that there are services out here for you should you get to that point where you're simply not feeling able to cope anymore. For example, in the private clinic where I work, I'm seeing so many people coming who have never had to attend a mental health clinician before. And people who've been, you know, a young person I saw who's been through unbelievable adversity and trauma through their lives, to come to this point where this isolation, this uncertainty, this instability is what's driven that person to attend. And I don't want people to feel frightened about presenting to their GP, to a therapist or to a psychiatrist. Like, we're here to talk through this crisis with you, to problem solve. It doesn't mean that you're going to have to take a tablet. There is no tablet or treatment for isolation, for loneliness. Part of what we need to do here is to instill a message of reconnection in the community and support for each other as far as is practicable within a stage 4 lockdown.